Hey everyone. Imagine being able to catch heart disease way before it even has a chance to become a problem.
Wouldn't that be amazing?
Absolutely. That's what Cleerly is trying to do, and it's why we're taking a deep dive into their story today.
It's a pretty fascinating one, actually.
For sure. We'll be looking at an episode of the Startup News podcast called Cleerly Raises 106 Emmers from Insight Partners for AI Heart Health Early Detection.
So basically, exploring how AI and healthcare are joining forces with a bit of a business twist thrown in.
Exactly. Whether you're an AI enthusiast worried about heart health or just love hearing about innovative startups, this one's for you.
And it all starts with a pretty scary fact. Heart disease is the leading cause of death in the U.S.
And so many people don't even realize they have it until it's too late.
It's like a silent threat lurking in the background.
You always think heart attacks are these sudden things, but the truth is, the groundwork for them can develop over years without you knowing.
That's where Cleerly comes in. They're using AI to analyze CT scans, the kind you might get for other reasons anyway, to spot those subtle early signs of coronary artery disease.
It's like we're used to getting screened for breast cancer or colon cancer, but heart disease hasn't really had that same level of preventative care.
Yeah, you're right. And Dr. James Min, Cleerly's founder, puts it perfectly. He says, at some point, we need to start screening the world for heart disease. It's a bold statement, but it shows how serious they are about making a difference.
To really grasp that impact, we need to understand how Cleerly's AI works, because it's not just about finding some plaque in your arteries.
Right, it goes much deeper. This AI can actually tell what type of plaque it is, where it's located, how severe it is. It's like getting a super detailed roadmap of your heart.
So it's not just a yes or no, like there's plaque or there isn't. It's giving doctors so much more information to work with.
Precisely. And that lets them personalize your treatment plan. It's not a one-size-fits-all approach anymore. It's about finding what's best for you based on what the AI reveals.
It's like personalized medicine, but even more advanced. And it all comes from a scan that's completely non-invasive.
Exactly.
Yeah.
Speaking of advanced, let's talk about their funding round. They just secured a massive $106 million and a Series C extension, led by Insight Partners.
That's a huge amount. And they already had a big Series C before this one, right? Like $223 million?
You got it. So what's with this extension then?
Yeah, it's not your typical funding round.
Think of it like this. You're on a road trip, and you think you've got enough gas to get where you're going.
Okay, I'm following.
But then you see a detour that adds some extra miles.
Yeah.
So you might need to top off your tank before you can keep going. That's kind of like a Series C extension for a company.
Oh, I see. So it's not that they're completely running out of money. It's more like they need a boost to take advantage of a new opportunity or deal with unexpected changes.
Exactly. And the fact that this extension was led by Insight Partners is pretty significant. They're a major player in enterprise software. They usually invest in companies that can scale quickly, like disrupt entire industries.
So they're not just betting on Cleerly to survive, they're betting on them to become a huge player in the healthcare world.
It seems that way. They see Cleerly as a company that could really change the game, not just in cardiology, but potentially way beyond that.
And then there's the news about Medicare approving coverage for Cleerly's plaque analysis test. Talk about a game changer.
Huge validation for their technology.
For sure, it opens up a whole new market for them.
Absolutely.
Yeah.
When Medicare, which is the biggest health insurer in the U.S., decides to cover something, it sends a powerful signal. This is valuable. This can actually make a difference in people's lives.
It means more patients will have access to it and Cleerly can keep growing and developing even better solutions.
It's a win-win. It shows that Cleerly is not just about fancy tech. They're committed to proving their science works and getting it to the people who need it most.
It's clear they're doing incredibly well. But it's worth noting, they're not the only ones working on AI-powered heart health solutions, right? There are other companies like HeartFlow and Elucid out there too.
That's true, but it's important to remember that AI in healthcare is still a pretty new field.
So it's like the Wild West out there. Everyone's trying to figure out the best way to do things.
Exactly. And honestly, the fact that there are several companies approaching this from different angles is a good thing. More innovation, more competition ultimately. That leads to better options for patients.
And given how big of a problem heart disease is, there's definitely room for more than one winner.
Absolutely. The end goal is to save lives and improve health outcomes. A little healthy competition can help us get there faster. It's really about giving people more control over their own heart health,
Yeah, like taking charge of your health destiny.
Exactly. And it's a big change from how we usually deal with heart problems, just waiting for symptoms and then reacting.
Right.
Imagine this. Instead waiting for a house fire to start, Clearly, it's like installing smoke detectors everywhere. So you're warned about the danger way before any real damage happens.
That's a great analogy. It brings us back to what makes Cleerly so innovative, their AI. It's not just looking for any blockage, it's specifically targeting coronary artery disease.
What's amazing is how much detail their AI can pull from a regular CT scan. It doesn't just say, oh, there's plaque. It analyzes what that plaque is made of, where it is, and how bad it is.
Wow, it's like having a super powerful microscope looking right into your arteries, giving you a level of detail that we couldn't get before.
That's exactly what makes Cleerly so powerful. It gives doctors a much clearer understanding of your individual risk so they can make better decisions about your treatment.
It's like the difference between using a basic map and having a GPS, right? But clearly, you're getting a personalized guide to better heart health.
And don't forget about accessibility. Cleerly uses tech that's already out there, CT scans. That means it can be integrated into existing healthcare systems pretty easily.
It's breaking down those barriers to early detection, making it easier for everyone to get the info they need to stay healthy.
And it's not just about the tech itself. It's also about the science behind it. Cleerly is doing this multi-year clinical trial, which is a really important step. It's proving that their AI can accurately find these heart conditions even before you have symptoms.
So they're building trust and showing the medical community that this tech is legit.
Right, and what's interesting is that Cleerly isn't trying to replace doctors with AI. They're all about collaboration between human expertise and artificial intelligence.
It's not about machines taking over. It's about giving doctors a powerful new tool to help them make better decisions.
It's combining the best of both worlds, the analytical power of AI with the judgment and experience of doctors.
A real dream team working together to get the best possible results for patients.
Now let's switch gears a bit and talk about the business side of things. Cleerly has secured a ton of funding. We're talking $106 million in a Series C extension, on top of a previous $223 million Series C.
Those are some serious numbers. And I'm still curious about that extension part. Is that something companies do often?
More often than you'd think, actually. It's like, imagine you're building a house and you've budgeted for everything.
Got it.
But then you decide you want to add a finished basement. That's going to cost extra, right?
Yeah, makes sense.
So Series C extension is kind of like getting a budget increase in the middle of a project.
I see. So it allows a company to keep moving forward without having to go through a whole new funding round, which can take a lot of time.
Exactly. And the fact that Insight Partners led Cleerly's extension says a lot. They're known for choosing companies that become big winners, especially in the software world.
So it's not just about keeping Cleerly going, it's about helping them grow quickly and reach those ambitious goals.
It's a sign that Insight Partners believes Cleerly could become a major force in the healthcare market.
And that potential is even more clear now that Medicare has decided to cover Cleerly's plaque analysis test. That's not just an endorsement, it's a huge new source of revenue.
Totally. When Medicare covers a test, it becomes available to so many more people.
It also tells private insurance companies that this technology is worth paying for, which helps Cleerly grow even faster.
It's like a ripple effect across the whole healthcare system. It encourages adoption and helps more people benefit from this groundbreaking tech.
And it's all because Cleerly has focused on proving their AI really works.
They're not just making some cool gadget, they're building trust and credibility, which is crucial for success in healthcare.
It all comes back to the big picture: who else is out there? We know Cleerly isn't the only company working on AI for heart health. There's HeartFlow, Elucid, and others.
True, but this field is still so young, the field of AI in healthcare. We're just getting started.
It's like we're witnessing a whole new era of medicine where technology and human expertise are coming together to solve some of the biggest health problems we face.
And the fact that there are many players involved is actually a good sign. It means more brilliant minds, more resources, and ultimately, more innovation.
It's like a healthy competition, pushing everyone to be better, to come up with even more effective solutions.
Especially when you consider that heart disease is still the #1 killer globally. We need everyone working on this.
Absolutely. It's not about one company winning over another. It's about working together to make a real difference in this global health crisis.
It's about sharing knowledge and learning from each other, both the successes and the failures.
And in the end, it's the patients who benefit most from all of this.
Now, going back to Cleerly, they're not just about building a successful business. They have a bigger purpose.
They want to change how we think about heart health, moving from a reactive approach to a proactive one.
They're challenging the status quo, working towards a world where heart disease isn't the silent killer it is today.
And with their technology, their funding, and their dedication to proving their science, they're on the right track to make that happen. Yeah, it's easy to get caught up in all the business and tech stuff,
Right.
but at the end of the day, we're talking about people's lives.
Exactly. Behind all the algorithms and the money, there are real people who could really benefit from this shift towards early detection and personalized heart care.
It makes you realize that this deep dive isn't just about some company or some technology.
It's about something much bigger.
It's about empowering people to take control of their health and maybe even avoid the terrible consequences of heart disease.
You got it.
So Cleerly represents this amazing combination of cutting-edge technology and a bold vision for the future and a real desire to make a positive impact on the world.
It really shows the power of AI in healthcare.
Yeah.
It gives us a glimpse into a future where heart disease might not be the threat it is today.
As we wrap up our deep dive into Cleerly, there's a lot to think about.
Yeah.
Like, what does it mean if everyone starts getting their heart screened regularly? How do we make sure everyone has access to these advancements, not just a select few?
Right.
And what role will AI play in shaping the future of healthcare as a whole?
These are tough questions, no easy answers. But by talking about these things and exploring the possibilities, we can help create a future where technology is used to improve lives and make the world a healthier place for everyone.
It's a future worth fighting for. And we really encourage you to check out the source material we've linked. There's so much more to learn there.
Absolutely. This deep dive was just the beginning.
It was just the tip of the iceberg.
Yeah. The world of AI and healthcare is constantly changing, and who knows what incredible breakthroughs are coming next.
So stay curious, keep learning, and maybe you'll even be part of the next big healthcare revolution. Until next time, thanks for joining us on the deep dive.